Okay, hi everyone. My name is Emilie Virgilio. I am the Squads Abroad Senior Program Specialist and Volunteer Engagement Associate. So I'm going to share my screen. When I'm sharing my screen, I won't be able to see any of the questions and comments that you guys might be commenting. So we can leave a Q&A session for the end. So I'll go ahead and share my screen. Okay, here we go. So Squads Abroad, we have been attending the Key Club conferences for the past couple years, but welcome to the first ever TeleSquads presentation. Today, I'll be focusing on our global health and education TeleSquads, and then tomorrow I'll focus on two of our other programs, STEM and business. So a little bit about Squads Abroad. We partner with key clubs and also different school groups, sports teams, even Girl Scout troops, and we partner them with communities from around the world to improve both health and educational outcomes. So we really want to make sure that we're having a sustainable impact in different communities abroad. Now, right now at this moment, so prior to COVID-19, all of our programs were based in our countries throughout Latin America, Africa, and we even had a refugee crisis program in Greece. But because of the prohibitance of travel and all of that, we really wanted to adapt our programs. So now we have the world's first virtual experiential learning and volunteer programs geared for high school students on an international level. Now, Squads Abroad, we're a part of our parent organization, Global Brigades, which is very similar to Squads, but it's the university level. So it's geared towards university students, and we're a registered 501c3 nonprofit. Wow. And we bring decades of international healthcare experience, and we really work with our different partner communities from the comfort of your own home or even a class. Here's a list of some of our partners. You'll see that we are an official Key Club partner, and I'm sure some of you are also familiar with HOSA as well. Now, I mentioned briefly before that we really want to have a sustainable impact. So we have an overall, we call it the Empowered 100 goal, and that's our commitment to empower 100 rural communities around the world to have them permanently rise out of global poverty. So basically, when a community becomes empowered, we no longer bring volunteers to that community, and they're self-sustaining and they're able to rise out of poverty on their own. A few years ago, the United Nations came up with a list of 17 Sustainable Development Goals, or SDGs. And our programs focus on 4 of those key SDGs, which is healthcare, education, WASH, and economic development. So our ultimate goal is to really create that blueprint to end rural poverty in our lifetime with our communities. Now we have a holistic model which really has us focus and address multiple aspects of a community rising out of poverty. We don't want to just focus on healthcare or just focus on education or economic development. We really want to bring in and focus in a holistic approach every single one of those aspects. And you can also see the university level brigades as well as our Squads Abroad programs, how they play into each part of that. So for example, we have on our sustainable health systems, the global health squads, dental and medical brigades. And then you can see for our economic development, we have global education and global business squads. Now, I already introduced myself. My name is Emilie Virgilio. I'm the Senior Program Specialist, and I've been with the Squads team for about 3 years now. The co-founder and president is Eric Werner. He's based out of Colorado and he has extensive experience. He spent some of his childhood growing up in a rural community in Colombia, and that really just spearheaded the rest of his passion for wanting to really have that impact of volunteering abroad and really giving the power for students to be able to have that impact as well. And then Courtney is one of our other program specialists, and she has actually had extensive experience during her university time. She volunteered with Global Brigades and went on 4 Global Brigades programs. We had recently this past year in 2019, we had one of the key clubs from Ross S. Sterling High School. They traveled to Guatemala. And if you go, you can see the link up at top, squads.org, and then our page dedicated to Key Club. You can check out their video and just kind of a more in-depth explanation of our programming and everything in country. Right now at this moment, it's a little difficult to actually show that video. So I definitely encourage you to be able to visit the website. And then as always, I'll leave my contact information and everything at the end if you want to reach out to me with any additional questions that are a bit more specific. Now, TeleSquads is a virtual squad, and we really help school groups and just student groups to be able to achieve the same learning outcomes as volunteering abroad. And we bring that same or even more community impact at significantly reduced cost because there's no need for airfare or lodging or a lot of the other logistic components that go along with a week or 2 of actually volunteering in a specific country. And another great positive is we also eliminate that negative environmental impact associated with travel. Now you'll see we have 4 different types of telesquads. Every single telesquad brings multiple components, and 3 of those include the international experiential learning, our skill-based community impact, and our cultural immersion. In our programming countries, we would always have a cultural learning activity in the afternoons after our morning of volunteering, and we really wanted to translate that to our telesquad programs as well. So I mentioned I'll be solely focusing today more in depth on our health and education telesquads. But as you can see, our health telesquads are really designed for aspiring health students. As I mentioned previously, we work a lot with HOSA. They're really popular with our HOSA members. And it's really just for high school students to really gain a stronger foundation to help spearhead them into the medical professional world. So you'll have an option to participate in live clinics. You'll really learn more about that medical vocabulary, build cultural competency, and all of that. With our STEM telesquads, you'll have the opportunity to improve the access for the communities for clean water. And with this program, a lot more of STEM components are involved, obviously, but it's really a lot more of preparation. So all of the measurements for the pipeline and the trenches and all of that really go into play here. And then going for our global business squads, they're really designed for students who are interested in going into the business sector. They really help build that business knowledge for yourself and then also for the community members or the quote unquote clients that you're going to be working with. So you'll have the opportunity to have that immersion and conversation with people in the community who have small businesses and really help bring those businesses up and share your best practices. And then lastly, with our global education telesquads, they're really designed for our language learners. So you'll have a great opportunity to be able to develop out and really learn all of the planning and preparation that goes behind actual lesson preparation. So you'll deliver out English as a second language lessons to those community members and under-resourced students that are based in Honduras at the moment. So right now, our global health and global education telesquads are focused in our programming communities in Honduras. We have multiple different communities, including Cantaranas and El Valle de Angeles, and they're located about an hour to an hour and a half outside of the nearest airport, Tegucigalpa. You can see from the picture up in the left that it's a super lush and green and mountainous. It's really an absolutely beautiful region. But unfortunately, right now, there are a lot of communities that don't have access to a lot of the basic needs. So what we're working on right now is being able to bring that to them. And then on the top right, you'll see this is just a typical breakfast. It includes refried beans, eggs, plantanos or plantains, and then there's also the typical cheese in Honduras, and you can see just up at the top some homemade tortillas as well. Now, not only will you guys have the opportunity to have an impact for the community, but you'll also have the opportunity for your own impact as well. Specifically with global health and global education telesquads, with global health, you'll have that international telemedical experience. You'll have exposure to unique case studies facilitated by actual international doctors. And you'll also have increased awareness of differences of international health and education systems. So it really is, as I mentioned before, a much deeper foundation and understanding, and this will really help you have a better base for then going on and continuing in university and beyond for your healthcare career. And then with education, you'll have experience, as I said, creating and also implementing those lesson plans. And then also you'll learn a lot about the best practices for being able to deliver lesson plans, especially towards English as second language students. And with both of them, you will have insight into effective sustainable development practices, such as empowerment, community buy-in, and really that cross-cultural collaboration. And every single one of our volunteers will receive a certificate of community service, which is around 20 hours, depending on the program itself. And then we also, with that, will send a community impact report. So that will just give stats on specific things catered towards the volunteer project that you did. So for example, if you participated in a global health telesquad, one of the stats could be the number of patients that went and visited the clinic, or the number of medications that were distributed, and all of that. And then of course, the impact for community is really why we do it as well. So there's an increased access to critical healthcare services and also English language learning that are otherwise limited or not affordable. Especially right now with COVID-19 and the global pandemic, the rural communities and the under-resourced communities are the ones that are the most affected right now. And if there wasn't access to basic healthcare services or medications and things before, it's even more so now. So we really just want to make sure that we're continuing to give that sustainable development and just that support that we promise to our community partners. Now here's a breakdown of a sample itinerary for a global health telesquad. Now, first, I just want to focus your attention up at the very top. You'll see that health telesquads, and actually any type of telesquad, can be scheduled between a 1 to 9 week period. So we just also understand, especially you all as key clubbers, you have so many different activities and your schedules can fill up pretty quick. So we want to also be flexible to you all. So you have the option to run a 1 week intensive telesquad where it's for multiple hours a day, every single day. or you can run it over a 9-week period and just have one session a day. So there's 9 total sessions, and you can do it, you can run this even during the school year where it's after school for an hour or two every single Wednesday or something like that. But we really want to make sure that we're also being flexible with you all. Now, to go into a little bit more detail with the Global Health TeleSquad itinerary. So session 1 is really more focused towards icebreakers, introductions. You'll learn a bit more about Squad's healthcare access program, and also kind of a bit more in depth about the holistic model aspect for healthcare and community development that I briefly touched upon earlier. You'll meet some of the coordinators and in-country staff members that you'll be working with for the duration of your TeleSquad. And we also want to hear from you. We're really interested why you are interested in going into the healthcare profession, you know, what sparks your passion and why you chose to join a health TeleSquad. The second session will focus a bit more on the country and then the cultural context as well. So you'll meet with a local doctor who will go into a bit more in depth about public and private healthcare systems, the challenges in Honduras, and also the specific challenges with that community as well. We'll have the opportunity to actually look in and discuss previous patient records and then analyze those specific trends from the specific community that you're going to be placed in. So that really plays a lot into the monitoring and evaluations, which is one of the later sessions, which I'll get into a bit more detail later. But that's also just why data intake is so important during every single one of our programs. The next session, you'll meet the community health workers. So the community health workers, or CHWs, are people who are in the community, and we empower them and we train them to become the health workers. So after a squad or a university group is finished their volunteering in a specific community, the CHWs stay in the community. They live in the community, and they're able to follow up and carry out the continued maintenance of our programs and all of that. So just really helping that sustainable impact and that long-term sustainable impact. So you'll be able to meet with them and discuss with them, go over any questions you have or things like that. And then also they'll talk a little bit more in depth about their role within the community to prevent and treat disease. The next session will go into a bit more discussion in regards to medications, the types of medicines that they use, even medicines that they have easier access to, or maybe medicines that are a bit harder to have access to. And then they'll also go into a bit more of an introduction about the traditional health practices that they do. Now, during a Global Health TeleSquad, your group will have the opportunity to actually live stream an urban clinic day. So you'll be shown through and you'll walk through the different triage stations or the different setups of the different consultations and all of that in the physical clinic in Tegucigalpa. So I mentioned that Tegucigalpa is where the international airport is, and it's a lot more urban, a lot more city center. So that's where the urban clinic day will be. And then the following session will be the rural clinic day. So because there is it's difficult access to actual live video streaming, we definitely don't have access to Wi-Fi or even data in some of our communities. What we're going to do is we will video record all of the key components of the rural clinic day. And it'll be also a bit more in depth with additional specialty doctors such as dentists and pharmacists and all of that. And we'll share that with you guys as well. The next session, there'll be a recap. So we'll go over what the World Clinic Day kind of went over, really talk about the summary. The doctors will go and explain to you guys the most interesting case studies, and then talk about some specific interactions that really stood out as well. Next is the monitoring and evaluation. So that's the data analysis. So basically, in order for us to determine if a community is empowered, or just to be able to make sure that a community is on the right track to be empowered, we need to intake all of the data and really be able to use that for our future groups and our future programs as well. So we'll go into a bit more of an explanation about that. And then finally, so I mentioned before that in our in-country programs, we would always have a cultural learning component basically every single day. So we wanted to also have that with our telesquads as well. And I personally think that the best way to learn and understand a culture is honestly through food. So we'll have a specific recipe and a video from a chef teaching you guys all how to create a typical dish for Honduras. And then on your own time, you'll be able to create that or attempt to. And then our final session will be the presentations of our mastered or attempted cooking. And then we'll also kind of have a reflection session on the experience overall. And then just talk about also what Squads Abroad is going to do moving forward as well, and how we're going to continue to make that sustainable impact. Now, so the next one, this is just the second half of an example of a global education telesquad. You'll see here on the right-hand side that with every single session, there is an equivalent self-paced activity. So there's that same thing with our global health telesquads as well, but it just wasn't reflected on the presentation just because I wanted to kind of give you a bit more in depth about our global health telesquads. But you'll always have a self-paced activity with every single session, and that's just stuff for you to do on your own time to be able to continue and just really have a successfully executed telesquad. So you'll see that sessions 5 through 8 focus on the ESL and Spanish classes. So you'll actually have a live stream English lessons and conversational exchanges as well, where you'll break down into groups. And this will all be facilitated by our in-country coordinator and led and implemented by all of you guys. So each ESL class will have a different theme. You'll see the first one is my family and home. The next is my town, my country, and then our shared world. And then each of the individual self-paced activities will be reflections and takeaways from that day, as well as preparation for the following language learning lesson that either the next week or the following day, depending on whether you want a 1 or a 9-week period. And then just as before in our Global Health TeleSquad, for our Global Education TeleSquad, we also want to have that cultural component as well. So it'll be this same where you're able to cook something, and then we'll also have a reflection on the volunteer experience as a whole. In every single telesquad, after the program is over, you'll receive the certificate of completion, number of service hours, and then also the community impact report and all of that. So donation goals. You'll see up at the top one of our landing pages for telesquads if you want to go visit there and look at everything a bit more in depth. So this is our breakdown for donation goals per volunteer. For 8 to 14 volunteers, it's $395 for a volunteer. For 15 to 29, it's $340. 30 to 49, it's $275. And then 50 and up, it's $195. So previously with our in-country programs, there are certain countries where we had to have a cutoff just because of the number of beds or the number of bedrooms that our home base had. But now virtually we're able to have just as many volunteers as possible for a single squad. So we really encourage just anyone who has a passion for making a sustainable impact abroad to join and volunteer. And then at the bottom, you'll see, so this is a donation goal breakdown for our Global Health TeleSquads, just to give you an example of where your donations are allocated towards. So 8% is really towards the community preparation. So all of the logistics and stuff that goes behind prepping a TeleSquad. The large majority of it goes towards the clinic days, you know, making sure that all of the stations are set up and all of the materials that are needed to have a successful clinic day or clinic days are all catered out. And then about 12% goes towards coordinators and also the healthcare professionals, so the doctors and dentists and pharmacists that we need to bring in. And then the majority of it goes towards the year-round sustainability and also the monthly doctor follow-up. So I mentioned previously, one of our components of sustainable development is the community health worker. So it helps go towards like those components and really making sure that we're working towards empowering and essentially leaving that community. Now, I understand that some of you might be a little intimidated. You might not want to bring together a group of a squad, but you still have that passion and you want to volunteer individually. We actually have an opportunity. We have an open enrollment session from this August 3rd through 8th. It's specifically Global STEM and Global Health TeleSquads in Honduras. So during that same week, we will run a single Global STEM TeleSquad and also a Global Health TeleSquad. And this is for individuals to join. So if you don't necessarily have the means to be able to bring your own group together, we definitely encourage you to join this. And you'll also see that specifically for Key Club members, there is a $50 scholarship. So the base program goal is $340, but with that $50 Key Club scholarship, it would be $290. And you can see, so our phone number, you can call and text our phone number, or feel free to email me, Emilie@squads.org. My contact information will also be on the last slide. So if you can't copy it down now, that's perfectly fine. But if you are motivated and you do have the opportunity, I definitely encourage you to mobilize a squad. It's definitely, especially with a TeleSquad, you guys all have the opportunity to not only just pull from members of your specific Key Club, but if you have Key Clubs close by or even on the other side of the country, you're more than welcome to create a TeleSquad together. It's so much easier to be able to collaborate and really work effectively together with multiple partners all across the country or all across the world as well. So the first step would be to choose a TeleSquad type, focus on what you're really interested in, the skills that you as a group are really wanting to improve and just learn more about as well. And then from there, we'll help pair you up with the specific community and the country that you'll be volunteering for. And then the next one would be to pick your dates and also the length of the TeleSquad. So we run programs all year round, summers, winters, over the holidays even. And then if you want to do a longer 9-week TeleSquad during the school year, we definitely encourage that as well. You would then just contact us, tell us the type of squad that you're interested in, the dates and the times and all of that. And then we'll actually create and send you a customized marketing kit. So that includes flyers as well as presentations similar to this, but with a bit more focused information. And you'll be able to share that with your club members, with other parents, with your advisors as well, with just anyone who might have questions about the programming itself or are also really interested in volunteering as well. And then lastly, but not least, you'll focus on promoting fundraising and also getting volunteers to enroll in your squad. So you'll see that there's a link at the bottom, healthsquads.org/telesquad/planner. So even though you'll see that the first landing page is healthsquads.org, this is the specific link to fill out a TeleSquad planner. So if you're interested in business telesquads, education, or STEM, feel free to follow this link and you can indicate which squad type on that form. And then last but not least, I just really encourage you guys to join a squad and make an impact. My name's Emilie Virgilio. Please feel free to email me, emily@squads.org, or feel free to call or text 559-761-0351. And that does accept calling or texting. So I really look forward to hearing from you all. I know that this is a bit different of an experience from the last couple of years of us being able to meet in person and really talk about things, but I'm also just so happy and so thankful that we were all able to come together and really pull this together, and you guys chose to learn a bit about squads. So now I will stop sharing my screen and we can go over if there's any questions or anything like that. There's a lot. So HOSA is the Healthcare Occupation Student Association. So it's a bit similar to Key Club, but it's a lot more focused on healthcare opportunities and things like that. So HOSA students, they are a bit more focused on professional opportunities and things like that. So they're really interested mainly in our global health TeleSquads. So are there any scholarships available for Key Club students who aren't able to cover the cost of participation? So as I mentioned, there is a $50 scholarship for Key Club students, as well as there isn't even a specific timeline. So we've had squad groups where they reach out to us and they want to fundraise 100% of all of their programming and goals and all of that. So if you come to me, you know, and say, I want to have a squad and I want to run a telesquad, you don't have a 6-month or even 8-month deadline. They took 2 years to fundraise 100% of what they wanted to. So that could also be your option as well. What would I recommend clubs to do to afford this trip? So actually, one of the really awesome things that I've been seeing recently is similar to the cultural learning activity. You can run kind of even through Zoom, a virtual Zoom session of a cooking class, and you can even cater it towards typical foods or something of the programming country, say Honduras or Panama or Guatemala or something like that. And you can have a donation or anything like that. But even though we are all virtual and we are needing to have that safe distance, so fundraising might be a little difficult, I have seen lots of options for people getting really creative virtually. So that's one option for you to do. So right now, Nikki said, is this completely virtual? If we cannot go on the actual trip, are there opportunities to still help from home? So at the moment, our telesquads are completely virtual. We are hoping to be able to bring our standard squads programming and in-country in the time being and in the future. But as of right now, we won't have any in-country programming until at least 2021. So that's just not only as a safety precaution for you all as well as far as international traveling, but also, as I mentioned, the rural communities don't have the same opportunities and just the same resources to be able to stay safe and all of that. So we really just want to make sure that we're not putting them in harm's way, and also not any of you guys as well. So it's just our in-country staff teams who either live in the communities or who are just outside of the communities. So yeah, and if you can't travel, this is how you help out at home. I see a couple questions about helping out at home. So definitely, I recommend joining a telesquad. You can even have, I've had a couple groups reach out to me, and they kind of want to have an ongoing year-long telesquad program. So even though they're 9-week periods, you can have different students sign up for different times, because I also understand it might be difficult to kind of all coordinate a time that works well with you. But all of these you can do from the comfort of your own home, or even if when school gets back in session, if you want to meet for like an hour or so after school in the same classroom, and then be able to join virtually from there. So yes, as I mentioned earlier, real travel services for the time being are suspended until January of 2021. We will reevaluate that closer to the end of the year. But as of right now, we actually do have some in-country groups and everything planned. I think our earliest is at the end of February, early March of 2021. But again, we just want to make sure that, you know, everything can completely change in a week or a month. So we really want to just follow the trends and the safety precautions, because safety is our highest priority. So how do you sign up for the Global Health TeleSquad? So you can either just reach out to me directly. My email is Emilie, Emilie, @squads.org, or you can visit our website, www.squadsabroad.org, and you can follow our request for information form to fill out on our page. But yeah, if you definitely just want the fastest way, you can reach out to me and I can send you all of that information. So during the education telesquads, who is the audience for these ESL lessons? Are they local children, adults, classroom settings? So yes, it's a classroom setting and it's for children. So it'll be for the students in that community. Each day we can focus on different ages of the students in that school. And then we'll also have, you'll see, so in that session, there was the overall lesson, and then there's also the opportunity for breakdown conversation. So the breakdown conversation will be in kind of smaller pairs as well. So it won't be just teaching to a large classroom or anything. And also keep in mind that class sizes, especially in rural communities in Honduras, are much smaller than class sizes you would typically see in the US. So yes, each volunteer does need to donate depending on how many volunteers there are. And this is to strictly cover, you saw the breakdown earlier, but it's really to cover the logistical expenses, as well as running a clinic can be pretty expensive. So being able to cover all of the components of the clinics, for example, there's an option to add on an optometry station and to just get your vision screened and all of that, where most of these kids have never even had their vision checked, or even the adults their entire life. So being able to have that opportunity to have the vision screening, and then we also even set up a mini pharmacy, usually in one of the classrooms or the community banks that we work in. So being able to give medications and all of that, especially to the really critical patients. So the virtual lessons, everything is completely free for the communities and for the students in Honduras or in Panama or the other countries that we operate in. Specifically for you as students, as volunteers, each volunteer does need to donate. And then, so is this the only going abroad program, or can we also do this from home? Yeah, as I mentioned, Telesquads is 100% virtual. You can do it from your home, or as I said, from your classroom as well, if you would like. Okay, I'm seeing a couple repeats, and then okay, so great question. Is there open enrollment opportunities for only health and STEM, or can we join a pre-established education telesquad? That's a great question. So there are actually, at the moment, there's just for health and STEM, but if we see that there's a lot of interest for an education or even for a business telesquad, we can have that opportunity as well. It is so much easier to be able to collaborate with students all across the US, all across the world as well, who want to really bring that sustainable impact versus coordinating flights and dates and all of that for an actual physical trip in country. So there's a lot more flexibility with telesquads. So typically I received the question, can you do more than 20 hours of community service for the telesquads? So typically it's usually around 20 hours. Now with the STEM as well as education telesquads, there's a lot more planning and preparation that goes into it. So the lesson planning that I was talking about, and then with the STEM, there's so much calculating and measurements and practices that go into during your own time as well. So you do have the option to be able to, as long as you're tracking those lesson planning hours and being able to bring it to us, that will help add the 20 hours of community service. And there was also the question of being able to do multiple sessions. There is no cap for how many sessions that you want to do. Even if you as a Key Club wanted to run 2 or 3 at the same time, you could have a STEM and a business squad running at the exact same time. So it's completely up to you. Okay, so minimum for a telesquad is 8. Um, aside from the open enrollment, if you just want to enroll individually or even with a friend or two, you can join that for this upcoming August 3rd through 8th. Okay, so I got the question, wow, 9 weeks for a telesquad. Does the cost increase tremendously for something that long? So no, the donation goal is the exact same, whether you want the 1 or the 1 week or the 9 week period. It just, the reason for the 9 week is if you only have one of those sessions a week. So you're doing the exact same volunteer programming and for the exact same amount of time in total. But with a 1 week program, you're just squishing it all into 1 week versus a 9 week program, you're really stretching it out. So with a 9 week program, you're still going to get 20 hours of community service because you're only meeting once a week. Whereas in a 1 week program, you're also getting 20 hours because you're meeting every single day for multiple hours a day. And so for the week in August, from 3rd to 8th, I got a question for how many hours per day will students be, for, yes, so usually each session will be able to just be each day, and there's a couple that we're able to combine. So sessions 4 and 5, they're both shorter sessions, so we're able to squish them into one. So we won't exceed more than, I believe, I think 2.5 hours, maybe 3 hours a day at maximum. Yeah, we definitely don't want the students just being staring at a screen for the large majority of a day. So it won't be anything like that as well. Great question. Okay, I'm seeing a couple more repeats. Okay, so another great question, how do you approach the specific SDG of quality education? So specifically with that, the largest thing is the CHARLAs, so the educational component that we have with every single squad type. So that is really like giving improved access to English lessons and things like that, and being able to carry it out. We also have language charlas or educational workshops for our health squads, STEM squads, and business squads as well. For example, one of our health squads charlas is proper dental hygiene. So teaching how to properly brush your teeth and everything like that. So that's definitely a sustainable way to carry out all of that. And I think the time is up, but thank you so much. If I wasn't able to read and answer your question, please feel free to email me directly, Emilie@squads.org, or give us a call. I can also send you this presentation or any other questions or specific things that you have. But thank you so much for taking the time to listen to my presentation, and enjoy the rest of the conference.